Diabetes is a problem globally, but especially in South Africa. We have the most people with diabetes in Africa. We have about 4.2 million people with diabetes. At least 52% of people who have diabetes now don't actually know they have it. So our prevalence may actually be closer to 8 million. And unfortunately in South Africa, due to poor access to care, we have a very high complication rate in people with diabetes.
Every year around the world, about 18.4 million people experience a foot ulcer or a foot wound. 50 to 60% of these wounds become infected, and 20% of which will result in a lower limb amputation.
Amputations are a stark reminder to clinicians like myself that we've unfortunately failed because it is a preventable complication.
I've seen so many unnecessary amputations and the detriment that it has brought to patients' lives.
I was 39 years old when I had my leg amputated. Bad lifestyle, bad eating habits, I think all led to this. We went out to the beach one day. It was extremely hot and I had my sandals on. I developed blisters, did all the wrong things. When I saw they had blisters, I walked in the water thinking the salt water would help. I think just made it worse. And when Christmas came, I had bought new sneakers and I wanted to wear them for festive season. And the pressure of the new sneaker, pressure on the blisters, and I was sick for a while. Went to the doctor for a checkup and they said the foot had turned septic and I needed to go to the regional hospital. And I was told that the leg would be amputated. I didn't think I would lose my leg. I didn't think it was that bad. I thought it was just a short-term illness. Because with diabetes, one day you're up, one day you're down. I thought it was just part of being diabetic. The prosthetic is a big part of my life. I'd be lost without it. Because I live in a flat on the 4th floor. So if I want to leave my house or do anything, I would have to use crutches and use my one leg, and it's uncomfortable. And also the weight issue. So I am dependent on the prosthetic.
It is devastating to not only the patient, but the patient's family. Because as soon as someone has a drastic amputation, then they can no longer work, which means that person then needs to go to SASSA and get a government grant. And that places a burden on the system, not only in terms of monies being collected by the patient, but someone who's not actually contributing to the economy. In terms of rand value, an amputation is at least 2 to 3 times more compared to wound care services.
The journey to an amputation is often a very complex one. Some patients begin with a minor amputation, and that might be an amputation of a toe, amputation of the midfoot, where the medical team try to preserve as much of the limb as possible. But often this may later progress to a below-the-knee amputation or above-the-knee amputation, and in some cases to an amputation of the remaining leg as well.
My first amputation was in April 2024. My second amputation was the 29th of September of this year, 2025. Me losing my legs, that was a great challenge for me, and not just for me, but my family as well. I had to make peace with it that I'm not going to get that leg back. I had to work my way around not having that leg and try to figure out things, how to do things. Then I could help myself to go to the loo and that. Now with the second amputation, I can't do that. So I am dependable on someone to be with me 24/7. And that is not a nice thing to have someone around you 24/7, because you never have your own space and your own time and your privacy. The second amputation, when the doctors told me they have to amputate, that was very sad news for me. So I didn't want it. I didn't want to give my consent. So I had to get my family in to give consent, to try to convince me. And afterwards I realized that it's either going to be me dying that night or to do the amputation. If I knew then what I know now, the knowledge that I know about taking care of my feet, I would change everything around. It actually would have saved me from losing my second leg.
If we think about the Western Cape province of South Africa, where we know there are an estimated 450,000 people living with diabetes, we also think that about 50% of people are living with the condition but not diagnosed. That is about 900,000 people, and currently we only have one podiatrist working in the public health sector of the Western Cape.
If I didn't have this leg taken off when I did, it was black as anything. The black would have stretched, gone up to my body, and I probably would have died by now. I never even thought about it in the beginning until this all came about. If you don't contain your diabetes, you will not have a good life.
Roughly 85% of amputations can be prevented by just doing proper wound care.
Really simple and focused evidence-based foot screening can take as little as 3 minutes. What's really important to look for is loss of protective sensation or peripheral neuropathy, or any issues with blood circulation or peripheral arterial disease, and then obviously to take a patient's history of whether they have had a foot ulceration or an amputation. And we have developed a very short guide to help train healthcare professionals to carry out the screening in their own settings. My qualitative research has provided insight around foot screening serving as a really valuable education opportunity for patients. Patients have shared with us that the hands-on and tangible nature of a foot screening really helps them understand their condition better.
Once we pick up the risk that the patient might be on getting diabetic foot ulcers because they can't feel anything because of nerve damage, they can then look well after their feet to prevent further damage and amputations.
This screening protocol, it is something that anyone can do, whether it is a registered nurse, a specialist physician, a podiatrist, allied health professionals, to look at a diabetic foot, do a simple screening, and then risk stratify them.
The hope that we have as clinicians is that we can design a pathway of care that is cost-effective, efficient, and easily upscalable across the platform in the Western Cape and especially in South Africa to detect foot lesions early, to prevent them, and thereby prevent lower limb amputations.
The nicest feeling is when I tell a patient, at least you don't have to see my face anymore. If you see my face, something is wrong with your foot. But if you don't see my face, then it means things are going well. And it means the world for me to be able to tell a patient, you have been discharged.
The more we create awareness out there, we can prevent all these unnecessary complications and preserve lives.